I had kind of a roundabout path in my research time. I started out doing basic science research and helped with some of the CVETs in the beginning and got to see it really, I think, transform our basic science, which has been really, really fun to watch. And then I fell in love with HSR. So now I'm doing HSR at SHOP. So I've gotten to see a few. And I think like one of the things that I've really enjoyed about being in Michigan is how collaborative, smart, and competent everybody is, and supportive. So you always feel like you find a home no matter where you are, no matter what kind of research you're doing. I've always felt like people are looking to ask what's best for me in my career. And I feel like my hardest questions to answer, like, what do I want to do in 5 years, rather than what's the next paper I want to write. So if you come here, you're going to be very productive and you just need to figure out what you want to do with the time that you're given. Collaboration is really, really common. In fact, it's expected both in the basic science realm and outside of the basic science realm. And I think I've learned so much more from looking at the intersection of different topics rather than just focusing exclusively on one topic at a time. And we have so many people, so many resources here that you really will find experts in almost every domain of medicine that touches surgery.
Yeah, thanks, Gloria, and thanks, Brooke. I'm one of the plastic surgery residents, and I was just going to say a lot of the similar things that have been said already. You get to pursue a lot of your interests during your research here. I started off primarily with an engineering and innovation. That's how I actually got to meet Dr. Cohen, working with Dr. Sederna. And then starting research here, I got plugged into patient-reported outcomes research and now health services research. And so I've gotten to work with Dr. Waldry. I think one of the amazing things here is you come up with an idea, and I guarantee you by the end of the week, you're usually connected with a handful of people who can answer your questions or are willing to collaborate with you. And that a lot of the people here have come from different institutions before, but there are very few places where it's actually all really well synthesized. And so I think one of the questions asked in the chat is, how do you pursue projects within these different centers? It's actually way easier to do it than you might think. We have collaborative sessions between the cores, and even though you're hearing about it individually here, it's typically a lot more coordinated. So I have no regrets about the ADT year, and I encourage you all to consider this place because you're very well supported during your ADT year.
Yeah, and ADT isn't just about it's very much about being productive and doing research, but it's not just about being productive and doing research. It's about making future academic leaders in surgery. So during that time, you aren't just focusing on learning methodology and designing experiments or designing research questions. You're also learning how to be a future leader. We have a leadership development program, both one that includes faculty and residents together. And then we also have a longitudinal program that goes throughout clinical years as well, that's focused exclusively on residents. And I think something that's important about Michigan is we really care about sending people out of here competent, not just as statisticians or whatever other methodology, but also knowing how to truly lead a team and sometimes how to lead an entire center.